Okay, this video is about how to write a medical textbook. And so first of all, I got some good news. To write a medical textbook, you really don't need to know anything about what causes diseases. I'm not kidding. All medical textbooks are basically a joke. The ones that are used to teach medical students and, let's say, internal medicine residents, for example. I'm literally not kidding. They don't tell you almost anything about what causes a disease. And that's one of the bizarre things. Kids go to pre-med, they go to med school, they do 3 years internal medicine residency. They've never been taught what causes disease. You think I'm kidding? I'm not joking. Talk to a medical student. Talk to them one of these days. Ask them, what causes atherosclerosis? What causes coronary artery disease? What causes autoimmune disease? What causes hypertension? They will not know. They will not know anything. Okay, and why is that? They went to so much school, they're relatively smart. It's because they waste their time with nonsense. You know, calculus, physical chemistry, mathematics, statistics, all this stuff. It's irrelevant to medicine. Okay, so anyways, how do you do it? How do you write the medical textbook? And like I said, by the way, when I was a medical student, I was like in awe of the Harvard textbook of pathology and pathophysiology. I'm like, wow, this is like the Bible of disease. I'll understand this and I'm going to save all these people. This is going to be great. And then now that I'm older and I know a lot about disease and epidemiology and nutrition and toxicology, I can tell you the books are a joke. They're a comic book, okay? They're typically 50 to 100 years out of date, more than that, all right? So as far as atherosclerosis and impotence, what do they say? Well, nobody knows it's associated with high cholesterol. That's a joke, okay? They'll never tell you Gregory Sloop wrote the best book on atherosclerosis. Atherosclerosis is just a blood clot, okay? Anything that causes blood to clot causes atherosclerosis. An infection, it's prothrombotic, it increases risk of atherosclerosis, okay? High-fat diet, it's prothrombotic, increases your risk of atherosclerosis. Something that constricts the vessel, sodium, is going to increase your risk of atherosclerosis, okay? Coronary artery disease, heart disease, you know, atherosclerosis accumulate in the coronaries. By the way, atherosclerosis causes impotence. All right, it's one of the most common causes. Just say it's due to high cholesterol again. Recommend pills, stents, and surgery. The reason why in every single chapter of the book they usually say they don't know the cause of the disease is when you don't know the cause, the natural thing to do is just give the patient a pill. So what I'm basically saying here is that the standard internal medicine textbooks, medical student pathology textbooks, they basically teach the students and the internal medicine residents and most of the internal medicine related subspecialties how to sell drugs. The way you sell a drug is you have to create a need in the patient. You tell them, you've got a problem, nobody knows the answer, take our pill, see if we can slow it down a little bit, okay? Instead of saying, look, we know the cause, avoid this thing, and you got a chance to get better, even cured. Never, never, never are you going to hear that. All right, so these are just some of the most famous doctors who've shown how easily they can cure coronary artery disease with a low-fat diet. Dr. Kempner, Blankenhorn, Armstrong, Ornish, Esselstyn, Pritikin. It's well known. It's obvious, okay? Autoimmune disease. Again, they just say it's idiopathic. Nobody knows the cause. A lot of people are genetically vulnerable. Therefore, you got to treat them with all these really powerful medicines for autoimmune disease and immunosuppressants that can really cause a lot of side effects. Don't mention Dr. McDougall having all this list of testimonials of patients cured. Don't mention leaky gut, the most important cause. Don't mention toxic chemicals like GP and F- that can damage tissue. And when the tissue is damaged, it can be turned into a DAMPs. That's a damage-associated molecular patterns. Okay, and your immune system recognizes, let's say, infections. Okay, those are called PAMPs, pathogen-associated molecular patterns. And damaged tissue can also confuse the immune system. First of all, the immune system has to clean it up, but it can also confuse it into thinking that it's something like a PAMPs, you know, and cause an autoimmune reaction to it. Okay, hypertension, you know. Again, same old story. Tell them it's idiopathic. The typical textbook is going to say it's 90 to 95% idiopathic or more. And then they'll say, rarely it can be renal artery atherosclerotic stenosis, which is a big joke. Okay, it's almost always due to high-fat diets as well as high-sodium diets and the deficiency of potassium and magnesium because people don't eat the plant foods. Don't tell them about Richard Moore's book. It's the best book by far ever on the subject, okay? Obesity, fatty liver, and diabetes. Same thing, idiopathic, some genetic vulnerabilities associated with obesity and hypertension. Don't tell them that, you know, there's all these estrogenic chemicals in the water and in the air and their food making them fat. Don't tell them, you know, all the stuff that's known about fat causing diabetes from Sweeney to Brownlee to Taylor to Shellman to Pritikin and others. Okay, don't tell them about the other causes of diabetes, like, you know, the Tetsumori Yamashima cooking oil component, the heavy metals damaging the beta cells in the pancreas. Don't tell them any of that stuff. You know, that's what I'm saying. You know, the poor patients, they're basically denied a chance at cure, okay? And the reason, you know, not only done that, they're also decreased in their ability to treat. It's all about selling drugs. Kidney disease, just again, tell them it's idiopathic genetic. Don't tell them all the patients that Kempner saved. Don't tell them about the book Stopping Kidney Disease by Lee Hull. I actually screwed up. I should have put that Stopping Kidney Disease on my list of all-time great medical books. The guy was a real smart kidney failure patient, not a medical person, but real smart, and he summarized everything you can do to slow down kidney failure, and he reversed his own kidney disease. Okay, gut diseases. Same thing. Tell them it's idiopathic genetic, or this time throw in gluten. And then we'll sell them some low gluten food. Okay. Don't mention Dennis Burkitt, abdominal pressure syndrome, or McDougall in his book Gut Tune-Up. None of that. Okay. Psychiatric disease. Just say it's idiopathic genetic. I mean, it's like this for everything. That's what I mean. It's a joke. Any idiot could just write every single disease is idiopathic. When it's idiopathic, doctor's an idiot. The patient's pathetic. Unknown cause. Genetic vulnerabilities. Therefore, no one knows you got to take our pill. It's always the same bullshit, okay? Medical school in the United States is a joke. It's basically training in drug dealing. It's an embarrassment. When you start knowing something about medicine, really study a little bit of epidemiology, nutrition, and toxicology, you're embarrassed of these books. They're just a disgrace. Okay, psychiatric disease. Again, they'll just say it's idiopathic, and then always pills, and more pills. And when the patient has a side effect, give them a pill for that. And when it's a kid, just give them more pills. So what if it causes long-term complications in these poor kids? Who cares about them? They're not your kids, and who cares? We're all atheists now in modern medicine based on science. There's no such thing as a human. They're all just talking, Darwinism. Everybody's just a talking ape or a monkey. You have no obligation to them. Okay, that's where that's what I'm trying to say is when you get down this path of atheistic Darwinism, there's no such thing even as a human patient. They're all just talking apes. You have no obligation to them. Why should you care about really helping them? Your job is to make money for your hospital and to sell drugs, make money for Big Pharma. Okay, you do that, you'll never get in trouble, and you make lots of money. What's not to like about that? That's why I'm telling you, you have to have Christian ethics, or you cannot really practice good long-term medicine for chronic diseases. I see it every day because we talked about this before. You do a stent, you get $30,000 for coronary artery disease. You do open heart surgery, you get $120,000. You teach them a vegan diet, you get nothing, maybe $1,000, $2,000. So who's going to do that unless they have Christian ethics? Okay. All right. It just goes on and on. It's the same for everything. It's like, and then in psychiatric disease, they don't tell them about food and mood. They don't tell them about soteria, where schizophrenic patients had much, much, much better outcomes just with residential supervisors than they did with the drugs. Don't tell them about all the things that contribute to cognitive dysfunction and anxiety and insomnia, excitotoxins, caffeine, mitochondrial inhibitors, SERC inhibitors that all push towards cellular damage. Don't tell them about religion, which helps people far more than psychiatry does. Don't tell them about the Rossetto effect with psychological effects of being with friends and family. Don't tell them about EMF opening up their blood-brain barrier or their voltage-gated calcium channels, causing damage to their mood centers and their cognitive centers. In psychology, just tell them it's all based on science. Don't admit you don't know the difference between a man and a woman when you talk about relationships. Don't admit that you don't know anything about role models or standards of excellence. Don't admit that religion works better. Just tell them what you're doing is based on science. Everybody thinks science is God right now. Don't tell them that science just means advertising, okay? All right, cognitive impairment again. Just say it's Alzheimer's, even though nobody knows what that is. Give them the pills, the standard pills, the algorithm. Don't waste any time talking to them. Don't tell them about Delatorre's mouse equivalent theory. Don't tell them about Peter Rogers' ND theory of neurovascular uncoupling. Don't tell them about Martin Pall and all his work on EMF and its contributions to cognitive impairment. Don't tell them about Douglas Calathresia Pretorius' theory of dormant bacteria and iron overload. Don't tell them about all the heavy metal data that we talked about in previous lectures as well, contributing to cognitive impairment. Spinal degeneration, same thing. Just say it's because of aging. Give them steroids or do surgery on them. This is DJD, degenerative joint disease, DDD, degenerative disc disease, DISH, diffuse idiopathic skeletal hyperostosis, OPLL, ossification of the posterior longitudinal ligament, OLF, ossification of the ligamentum flavum. Just say it's all due to aging. Get them on pills, steroids, and surgery, okay? Don't mention the Pete Rogers theory of ischemia and toxins causing changes to the collagen, okay? You do these things, remember that the rest of your career. It's all due to idiopathic unknown causes or genetics, and the patient needs pills or surgery. You'll make a lot of money. Your hospital will be happy with you. You'll never get in trouble. That's how you write a medical textbook.